好，咁我今日就要拍埋呢個 historical fields of mental disorder and mental health nursing。咁個 learning outcomes 就係 by the end of this section 咧，students should be able to define mental health and mental illness and recognize signs of each. Describe how ideas and treatments for mental illness have changed over time. Summarize how psychiatric care moved from asylum to community services. Identify key figures who shaped mental health nursing. Explain how psychotropic drugs, the DSM, and bring science influence today's mental health nursing practice. Mental health 個 definition 咧就係 a dynamic state in which thought, feeling, and behavior that is age appropriate and congruent with the local and cultural norms and is demonstrated. The successful adaptation to stressors from the internal or external environment, evidenced by thought, feelings, and behaviors that are age appropriate and congruent with the local and cultural norms. 即係簡嚟講，係一個 dynamic state in which thought, feeling, and behavior are age appropriate and congruent with local and cultural norms 啊。咁咩為之 mental illness 咧？mental illness 係一個 maladaptive sorry mental illness 係一個 maladaptive response to stressors from the internal or external environment 啦，evidenced by thoughts, feelings, and behaviors that are incongruent with the local and cultural norms and that interfere with the individual's social, occupational, and physical functioning. A syndrome characterized by clinically significant disturbance in an individual's cognition, emotional regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental process underlying mental functioning. Mental disorders are usually associated with significant distress or disability in social, occupational, or other important activities 咁簡單嚟講就係一個 dysfunction in psychological 啦、biological 啦同埋 developmental process。咁 nursing 就係要 nursing integrates the art and science of caring and focuses on the protection, promotion, and optimization of health and human functioning, prevention of illness and injury, facilitation of healing, and alleviation of suffering through compassionate presence. Nursing is the diagnosis and treatment of human responses and efficacy in the care of individuals, families, groups, communities, and population in recognition of the connection of all humanity. 咁 mental health nursing 咧，根據呢個 American Psychiatric Nurses Association 咧，就係 support people's well-being through prevention and education, as well as assessment, diagnosis, care, and treatment of all types of mental health and substance use disorders. Psychiatric mental health nursing is both an art and a science, employing a wide range of nursing, psychosocial, and neurobiological expertise to achieve positive mental health outcomes. 咁nursing a definition and scope nursing integrates the art and science of caring, focusing on protection, promotion, and optimization of health, prevention of illness, facilitation of healing, and alleviation of suffering through compassionate presence. Diagnosis and treatment of human responses and efficacy for individuals, families, communities, and populations. A historical perspective of healthcare and nursing from traditional to modern societies. In traditional societies, health was a private matter but not a public concern. No external authority to deal with any health issue. For peasants and town dwellers, illness was considered in religious terms attributing to the presence of evil spirits or sins treated by folk remedies or treatments that have been passed down from generation to generation. Emphasis on the success of healing rather than scientific evidence and explanation. 咁加嚟講 health viewed as private illness explained by evil spirits or sins treatment by folk remedies 即係嗰啲草藥啦。Care and healing took place in domestic setting at home and women often learn home remedies as an integral part of learning to manage the home. From 15th to 17th century, there were then different types of healers, including professional physicians, apothecaries, folk healers, bone setters, and folk healers, etc. Note that about 1/3 of those involved in healing were women. Institutional changes in healthcare, rise of the medical profession, the growth of the hospital system, and the introduction of modern scientific medicine. Medical Restoration Act in mid-19th century, which established medicine as a state-regulated profession. Doctors worked in the institutional settings of hospitals rather than within the domestic setting at the bedside. Medical research 就係一個 mass observation monitoring of the sick and patients' symptoms could be recorded and correlated with pathological findings after death. Shift focus of the medical profession. Doctors shifted their focus from the bedside to the laboratory in hospitals, and this called for the need for reliable workers at the bedside to observe patients and carry out doctors' instructions. Nursing work before the reforms of Florence Nightingale, poor working condition and poorly paid, employing women of chairwoman class with limited ability, likely to be old and illiterate. But doctors began to reform the education and working condition of nursing staff even before Nightingale's reform. Historical overview of psychiatric care. Insanity was linked to demonic possession. Correlation of mental illness to demonology or witchcraft led to some mentally ill individuals being executed. Healers used rituals with herbs, ointments, and stones to remove spirits. Mental illness was seen as incurable, and treatments were often harsh and cruel. Insanity was linked to demonic possession. Healers used rituals with herbs, ointments, and stones to remove spirits. Mental illness was seen as incurable, and treatments were often harsh and cruel. Ancient to pre-modern views of mental health, ancient explanations and treatment. Many ancient cultures attribute abnormal behavior to supernatural forces, spirit possession, curses, or punishment from gods, leading to ritualistic or religious cures such as exorcism, purification, or sacrifice. Greek and Roman physician Hippocrates gradually introduced a natural explanation, proposing that mental disturbance arose from imbalance in body humors and recommending diet, rest, and environmental changes instead of purely magical practices. Body humors, black bile, yellow bile, pilum. Middle Ages and Witchcraft Association. In medieval Europe, mental illness was often linked with witchcraft, sin, or moral failing, and people with disturbed behavior could be punished or exiled rather than treated. Some individuals were confined in monasteries, poorhouses, or prisons, where care was custodial and frequently harsh, reflecting societal fear and stigma rather than therapeutic intent. Early institution and ship of fools. Historical records describe people with mental illness being sent away on ships or moved from town to town, a practice sometimes referred to as the ships of fools, symbolizing social exclusion. Gradually, mental illness began to be perceived as a medical problem. This notion gave rise to the establishment of specialized units and began to confine lunatics in separate sections of general hospitals or charitable institutions, setting the stage for later purpose-built asylums. 18th centuries, first hospital in America admitted clients with mental illness. Benjamin Rush, the father of American psychiatry, initiated the provision of humanistic treatment and care for clients with mental illness, include kindness, exercise, socialization, stressed the need for pleasant around surroundings and moral treatment for the mentally ill, employed harsh methods such as bloodletting, purging, various types of physical restraints, and extreme of temperatures, tranquilizer chair, and the gyrator. Rise of asylums. Asylum movement and moral treatment. From the 18th to 19th centuries, specialized asylums were built around in Europe and North America, justified as place of safety, order, and treatment for people with mental illness. Reformers such as Philippe Pinot and William Tuke promoted moral treatment, emphasizing kindness and structured daily routines, meaningful occupation, and minimization of physical restraint, which improved the condition in some institutions. Recognition of the insane as fully human. Influential figure. Florence Nightingale, Dorothy Dix. Rise of asylums and early psychiatric nursing. Emergence of psychiatric hospital and custodial care. Over time, many asylums became large, overcrowded psychiatric hospitals, where care shifted back towards custodial management, with limited therapeutic options and strict hierarchies. Nurses provide basic bodily care, supervision, and control, with little formal training, and practices could be authoritarian, and task-oriented. Initiation of community health movement. Emergence of psychiatric nursing. Linda Riches, first American psychiatric nurse. Establishment of first school of psychiatric nursing in 1882. Provide training in custodial care for clients in psychiatric asylums. The training did not include the study of psychological concepts. Significant change in psychiatric education till 1955. Curriculum stress nurse-patient relationship and therapeutic communication techniques, nursing intervention in the somatic therapies. Insulin and electroconvulsive therapy incorporate all those concepts into the profession's body of knowledge. By the late 19th and early 20th centuries, formal training schools for mental health nurses appeared within psychiatric hospital, gradually professionalizing the role. The evolution of mental health approaches. Humane reform and the mental health movement, from institutions to community care, began with recognition that state psychiatric institutions were overcrowded, inhumane, and ineffective. Moved mentally ill patients from large institutional settings to community-based treatment centers. Shift from isolation and custodial care to integrate person-centered community support. Human reform and the mental health movement. Moral treatment movement. Emphasize humane, dignified care for individuals with mental illness. Removal of mechanical restraints and co- 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 coercive practices. Improvement in physical environment, nutrition, and basic hygiene. Emphasis on therapeutic relationship and respect for patient autonomy. Meaningful activity, occupation, and social inclusion reflects societal belief that the mental ill deserve compassion, not punishment. Impact on modern nurse practice. Nurses now work in diverse settings: community clinics, day centers, supported housing, primary care. Focus shift from surveillance and control to therapeutic engagement and recovery support. Recognition that mental health treatment is most effective when delivered with respect and within patients' communities. Biological foundations in psychotropic medication, neurobiology and neuroscience. Neurobiology, the study of the nervous system's biology, particularly how the brain functions at cellular or molecular levels. Neuroscience, the broader scientific study of the central nervous system, including structure, function, and behavior. Together, these disciplines reveal how brain chemistry, neural networks, and genetic factors influence mental health and mental illness. Psychotropic medication, medication that alter brain chemistry to influence behavior, mood, and feelings, including antipsychotics, anti antidepressant, depressants, mood stabilizer, anxiolytics. Mechanism of action: act by modulating neurotransmitters such as serotonin, dopamine, noradrenaline, GABA in the brain. Restore neurochemical balance, reducing symptoms and improving function. Clinical implications for mental health nursing. Understand that mental illness has biological underpinnings. It is a medical condition, not a character flaw. Psychotropic medication are essential tools but should be combined with psychosocial interventions, therapy, and community support. Nurses must educate patients about medication benefits, side effects, and importance of adherence to promote recovery. Deinstitutionalization, community care, post-war reforms, and deinstitutionalization. Many countries implemented deinstitutionalization from the 1950s onwards, closing large asylums or downsizing them and shifting care to psychiatric units in general hospitals and community services. Expansion of community and multidisciplinary care. Community mental health centers, home treatment teams, and rehabilitation services developed. Nurses playing key roles in case management, psychoeducation, and support in patients' own environments. Psychiatric nursing education, integrated psychology, social science, therapeutic communication, and family work, moving away from purely custodial models towards psychosocial and recovery-oriented practice. Contemporary psychiatric nursing, contemporary and advanced practice roles. Modern mental health nursing spans acute inpatient units, community programs, forensic settings, primary care, and digital tele-mental health. Strong emphasis on human rights, trauma-informed care, and reduction of coercion. Advanced practice psychiatric mental health nurses and nurse practitioners now provide psychotherapy, complex case management, reflecting the evolution from attendants to highly specialized clinicians. The overview of the evolution of mental health approaches. Early treatments. In ancient times, mental illness was often attributed to supernatural forces. Treatments include rituals, trampanation, and herbal remedies. Asylums and institutionalization. In the 18th and 19th centuries, people with mental illness were often confined to asylums. The focus was on custodial care rather than treatment, with many patients subject to harsh conditions. Moral treatment movement. In the early 19th centuries, advocates like Filipino and Dorothy Dix promoted more humane treatment, emphasizing kindness, rehabilitation, and a structured empowerment. Psychoanalysis. In the early 20th century, Sigmund Freud's psychoanalysis introduced the idea of exploring the unconscious mind. This approach influenced the therapy practices and emphasized talking as a therapeutic tool. Biological perspectives. The mid 20th century saw a shift towards understanding mental illness through biological and neurological frameworks. This led to the development of psychotropic medication such as depressants, antipsychotics, and mood stabilizers. Community mental health. The 1960s and 1970s brought about the institutionalization, moving care from the asylums to community-based settings. This approach aimed to provide support in less restrictive environments, though it also faced challenges related to access and resources. Integrated approach. Today, treatment often combines medication, psychotherapy, and holistic methods. Cognitive behavior therapy, dialectic, dialectical behavior therapy, and mindfulness practices are popular therapeutic approaches. Trauma-informed care. Recent advancement emphasize understanding the impact of trauma on mental health and integrating this perspective into treatment. Personalization and technology. Current trends focus on personalized treatment plans and the use of technology, including teletherapy and mental health apps, to increase accessibility and engagement. Mental health evolution. The institutionalization, deliberate shift from institutional care in state hospitals to community-based treatment. Community mental health centers provide less restrictive care closer to patients' homes. Proximity benefits include stronger connections with family, friends, and local support. Community care advantages, personalized treatment, outpatient therapy, crisis intervention, and rehabilitation. Reduce stigma by normalizing mental health treatment within everyday community settings. 19th century reformers. Sir William Charles Ellis, English physician, superintendent of the first purpose-built asylum in England. Treatise on Insanity established psychiatric as a profession and formalized the field of psychiatric nursing, igniting psychiatric care within humanity, made them feel valued and appreciated, so that they could recover from their self-esteem. Great principle of therapeutic employment, humane treatment, and moral therapy. Dorothy Dix, an early 19th century American activist and mental health care reformer, focused on the issue of asylum reform, noted that mentally ill patients were treated like animals in 19th century America, and she influenced opening 31 state asylums to care for them, supported better care for the mentally ill, culminated in the restructuring of many hospitals both in the United States and abroad, championed the value of humane care for the mentally disabled and emotional disturbed. Florence Nightingale, the founder of modern nursing, the lady with the lamp, revolutionized medical practice through her innovative approaches to healthcare and dedication to improving patient outcomes. Efficacy for sanitation significantly reduced mortality rates among patients. Pioneering use of data analysis in healthcare and her establishment of nursing education standards laid the foundation of the nursing profession as we know it today. Linda Richards, the first professionally trained American nurse, the founder of American Psychiatric Nursing, established nursing training program in the United States and Japan, created the first system for keeping individual medical records for hospitalized patients. Sigmund Freud, development of psychoanalysis, psychosexual therapy theories, and neurosis. Psychoanalysis as both a treatment method and a theory of personality development, insights about the unconscious mind and the structure of personality, comprising the ID, ego, and superego. Carl Gustav Jung found analytical psychology integrated spiritual concepts, reasoning, ancestral emotional patterns, mysticism, and the creative nature of humans. Introduced extrovert and introvert personality types, which laid the groundwork for personality assessment. Central to his theories is the process of individuation, which involves the integration of conscious and unconscious elements. Influence psychotherapeutic practices, emphasize personal narratives, symbolism, spirituality, impact on holistic approaches to mental health. Hilgard Peplow, first psychiatric nursing theorist, the first published nursing theorist since Florence Nightingale, with her nursing theory of interpersonal relations, which helped to revolutionize the scholarly work of nurses. She is considered the mother of psychiatric nursing, authored interpersonal relationship in nursing. In her World War II service, she was the first to develop innovative and unique talk therapy for combat fatigue, now called post-traumatic stress disorder, PTSD. Also a primary contributor to mental health law reform, she led the way towards humane treatment of patients with psychiatric, behavior, and personality disorders, committed to nursing education throughout her career. Now, for the classification systems, there are DSM-5-TR, Diagnostic and Statistical Manual of Mental Disorders, ICD-11, International Classification of Disease, Benefits of Classification, Common Language and Communication among Professionals, Guiding Assessment and Treatment, Research and Evidence Building, Service Planning, Policy and Funding, Clinical Utility, and Global Applicability. The DSM lists symptoms clinicians use to diagnose mental disorder. It has 6 editions since 1952. DSM-1, DSM-2, DSM-3, DSM-3R, DSM-4, DSM-4-TR, DSM-5, DSM-5-TR. The 11th International Classification of Disease, ICD-11. The global standard system used to classify disease and health conditions, including mental, behavior, and neurodevelopmental disorders, developed by the World Health Organization. Use of DSM versus ICD in hospital. In hospital, clinicians typically use DSM as a clinical guide to define mental disorder and ICD as a coding system for records, statistical, and billing. DSM in day-to-day clinical work. Clinicians use DSM criteria to decide which diagnosis best fits the patient and to document it. DSM language guides case formulation, treatment planning, and communication in clinical notes and case discussion, even though clinicians also rely heavily on broader clinician information beyond the formal criteria. ICD for coding, billing, and statistics. Hospital records need ICD codes for hospital administration. Mental health diagnoses are converted into ICD-10, ICD-11 codes. For discharge summaries, activity statistics, and epidemiology, these ICD codes are what hospital information system. Mapping between DSM and ICD in practice. Modern DSM editions include the corresponding ICD codes next to each diagnosis, so clinicians can document using DSM wording while assigning the correct ICD code in the electronic record. 咁我而家講完個 PowerPoint，咁講下個總結先啦。 咁簡單嚟講，個 evolution of psychiatric care ancient to pre-modern view。咁supernatural explanation 啦，Greek Roman shift 啦，Hippocrates introduce humoral theory 啦，即係啱啱講到嘅 black bile 啊，yellow bile 同埋 pilum and efficient diet rest and environment。Ship of fools 啊，即係啱啱講到嘅town to town 之間將嗰啲有病嘅人去轉運啦，symbolize social exclusion。Gradual perception of mental illness as a medical problem led to early specialized units within general hospitals. 18th century's milestones. First American hospital admits mental ill patients. 啱啱講到 Benjamin Rush, father of American psychiatry, promoted kindness, exercise, socialization, pleasant surroundings, but also used bloodletting and restraint. Rise of the asylums 17世紀至18世紀啦，moral treatment 咧，18世紀至19世紀 moral treatment 咧，啱啱嘅 Pino 同埋 Tuca kindness, structured routines, meaningful occupation, reduce restraints. Influential reformers 包括 Florence Nightingale 啦、Dorothy Dix 仲有Sir William Charles Ellis。咁 early psychiatric nursing 啦，19th centuries to 20th centuries Linda Richards first American psychiatric nurse, 1882 School of Psychiatric Nursing focus on custodial care。仲未有 psychological concepts 咁 1955 curriculum shift, emphasis on nurse-patient relationship, therapeutic communication, somatic therapies, insulin, ECT, deinstitutionalization and community care post-World War II, large asylums downsized or closed, care moved to psychiatric units in general hospital and community mental health centers. Roles expanded to case management, psychoeducation, home treatment, contemporary psychiatric nursing settings, acute patient, inpatient, community programs, forensic, primary care, telemental health, emphasize on human rights, trauma-informed care, reduction of coercion, advanced practice nurses provide psychotherapy, complex case management, and leadership in multidisciplinary teams. Biological foundations and psychotropic medication, neurobiology study of brain functions at cellular/molecular level. Neuroscience, broader study of CNS structure, function, and behavior. Psychotropic medication classes, antipsychotics, antidepressants, mood stabilizers, anxiolytics. Mechanism, modulate neurotransmitter 啦，啱啱講嘅 serotonin 啦、dopamine 啦、noradrenaline 啦、或者 norepinephrine 同埋 GABA 啦 ，to restore neurochemical balance and reduce syndromes. Nursing implications. Educate patients on benefits, side effects, and adherence. Combine medication with psychosocial intervention for recovery. Classification systems, DSM-5-TR, ICD-11. DSM-5-TR, clinical purpose, clinical diagnostic criteria, guides assessment, treatment planning, and communication, major depressive disorder. 咁就有呢個 ICD-11 International Coding for Records, Statistics and Billing. Clinical workflow. Clinician use DSM criteria to decide diagnosis. ICD code is recorded for administrative purposes. 啱啱講到嘅 key figures in mental health nursing 啦，就有 Benjamin Rush 佢嘅 contribution 就係 humanistic treatment 啦、moral involvement 啦、early American psychiatry 咁仲有呢個 Philip Pino release patients from chains, advocated moral treatment. William Tuca founded York Retreat emphasizing humane care. Dorothy Dix championed asylum reform in the U.S. lobbying for state hospitals. Florence Nightingale, professional nursing, professionalized nursing, emphasized sanitation and record keeping. Linda Richards, first American psychiatric nurse, established nursing school. Hildegard Pablo, first psychiatric nursing theorist, interpersonal relation theory. Sigmund Freud developed psychoanalysis, ID, ego, superego model. Carl Jung, analytical psychology, introversion slash extroversion typology. Core learning outcomes restate define your mental health and mental illness, recognize their signs, trace the historical evolution of ideas and treatments for mental health illness. Summarize the shift from asylums to community services, identify key reformers who shaped mental health nursing, explain how psychotropic drugs, the DSM, and brain science influence modern practice。咁我講完呢一課